Yeah, so thank you, brother, for joining us, for letting us this conversation. It is important because you are a successful varicocelectomy case. Actually, this guy is, how old is he?
He's 2 years old.
2 years old. So 2 years before you had the child.
Yeah.
This 3 years.
Thanks to HAXI.
You did what, IVF, right?
IVF.
IVF, right? And after IVF, you find me for varicocele surgery.
Yes.
So you tried for the second baby.
Yes.
But did you? How many months did you try?
For the second baby.
Yes.
Before the surgery.
Yes.
Before the surgery, many years, because
you tried it many years.
Yeah.
Then you had this guy with
Yes.
IVF, mashallah.
Yes.
Then for the second child, you thought varicocele surgery may work.
Yes.
So many gynecologists say that varicocele surgery never works.
Yeah.
You have to do IVF. It is not true. I have many patients like that with successful, and so you had great veins. Really, one of the most extreme cases we have before. And in the operation, it was very successful. We take them out. What do you prefer for people who live not in Turkey forever? Is it possible to do such a procedure? What's your opinion?
I think it's possible to do such a procedure because, as you know, it's for one day. You stay at the hospital for one day. You can take an hotel, and you can just.
How many days should they stay here?
I think they should stay 3 days.
3 days.
I think it's good for them. 2 to 3 days. I'm from France personally, so I can assure you that it's the best thing for you to do 2 to 3 days and come to see Dr. Junaid. I think it's the best.
Thank you. Then after your operation, how many months later you had the pregnancy?
So 4 months after the operation, my wife got pregnant.
Yeah, actually, it is not that quick as always because your varicocele veins were extreme. Really one of the biggest veins. So when we take out such veins, the response is sometimes very quick, and sometimes really we have very quick responses, and the pregnancy comes. We can't guarantee. I guarantee 100% that I will do my best. I am experienced in this. You know our technique. We take out the veins. This is a special, different technique, and still these guys, sometimes the response will not be as quick as yours. Sometimes there may be no response, no sperm change, or the pregnancy may need IVF again, but still IVF rates are higher, the success rates are higher. So he wants to talk to you, he doesn't want you to talk to me. So this is good. So now your wife is pregnant for how many months?
So 11, so now...
yeah, nice. No,
sorry. In November she's...
She is expecting to have the baby.
Yeah.
Okay, mashallah. We will pray, inshallah, everything will be all right. So you are not, but you are living in Turkey right now.
Yeah, right now, yes.
Yes. Yeah, it's good. But you can say it's possible for the patients from other countries to have this. And we can say IVF is not the only solution for varicocele patients. And you had the pregnancy, everybody can have this. Especially if there is very enlarged big veins visible from outside. This is grade 3 varicocele. Even you do IVF, please after the IVF go to urologist and make your problem solved. It worked for you, it can work for everyone. Thank you for joining.
Thank you very much. Thank you, doctor. Thanks.